My name is Denise Akins, and I will be discussing impaired nurses in the workplace with Tamika Watson. So nurses are often the first to treat and to last to care for patients, and many in the profession are dealing with stress, fatigue, and personal problems that cause them to turn to drugs. So this is known as substance use disorder, which is an umbrella term that refers to dependency, addiction of drug and alcohol. The American Nurses Association says that approximately 10% of nurses are dependent on drugs. So with nearly 3 million nurses in the workplace, about 300,000 of those nurses are substance abusers. So how does this impairment affect the nurse? So statistically, impaired nurses are less reliable at work. This is mainly because of their impaired judgment and their slow reaction time. Because they're not in their right mind, they're more likely to be involved in a workplace accident. And like many other hospitals within the United States, especially St. Vincent's, if a nurse or any healthcare employee is involved in an accident, the first thing you do is get drug tested because they want to make sure that drugs isn't the cause of this accident. Nurses are also more likely to be injured on the job, and of course they're going to compromise patient safety because they are more likely to have medical errors. So hospitals are filled with prescription painkillers, and of course this is a problem for nurses with addictions. And these medicines may induce strong cravings that heighten the temptation for nurses to steal drugs. This is very, very the case in nursing specialties such as anesthesia, critical care, oncology, and psych, because these drugs are more readily available. Another addiction trigger is the stress of the job. It's no secret that RNs, we work long shifts. There's mandatory overtime. There's shift rotations. There are emotional demands. So more and more nurses are becoming more physically, mentally, and emotionally exhausted, which is requiring for them to adopt new ways to cope with their stress. So what are the signs of addiction in nurse colleagues? So the first and foremost, you want to watch for physical and behavioral symptoms. This includes symptoms such as fatigue, tremors, dilated pupils. You may notice that the nurse may become frequently angry, or they may lie a lot, even when it's not necessary to lie. They also may develop a lack of concentration, and in some cases, they may laugh inappropriately at things that aren't funny. You're also going to notice that they're going to have a marked decrease in care. So this is the nurse that was once upon a time coming to nurse. They were neat, they were tidy, they were professional looking. Now they're untidy, their uniforms may be dirty, they don't comb their hair, they just don't care about their appearance anymore. They're also going to have unexplained absences from the nursing unit, especially during times where they may be needed. They run off, we don't know where they are. They're going to have frequent tardiness, they may request to leave work early. Of course, they're going to be increased narcotic sign-outs. You will notice them going into the PICSs, getting narcotics out and getting a new witness every time. So that means they're getting a new nurse to sign out if they're getting pain medications. They're also going to have frequent reports of pain relief from assigned patients. So this is the nurse who's saying that her patient is not getting pain relief and she's giving the medications too frequently. Instead of giving it to the patients, she's stealing them. And then they may offer to medicate patients that are not assigned to them.
Thank you, Denise. For part 2, we're going to continue the discussion of addiction and nurse colleagues. Okay, so in addition to what Denise discussed, and she did discuss personality changes, that is true. But in addition to that, you may also notice mood swings in your colleagues. They're going to make frequent excuses why they can't perform something or why they need to go step away from the unit, or just common excuses. You may notice inappropriate wearing of long sleeves. Maybe that's designed to cover track marks if there's an IV. Medication usage problem. They will have a difficult time with authority. They will have extreme changes in their work performance. There will be physical indications such as track marks, which we discussed, the inappropriate wearing of long sleeves to cover up those marks. You may notice bloodshot eyes if alcohol is involved. They will have a decline in personal appearance, or they may have a decline in personal appearance. There may be unexplained or significant weight loss or gain. There will be medication tampering signs, such as your bio bin. You may notice just it's been tampered with. Perhaps they were fishing for narcotics in there. Let's see, they will have very inaccurate judgments when it comes to patients. So patient safety is a big problem with nurses who are addicted to substances, alcohol or drug substances. Signs of diversion may include unjustified or inconsistent narcotic administration. The colleague may make frequent bathroom visits or break room visits. You will see an increase in medication wastage or heavy medication wastage. They may frequently volunteer to administer pain medication for other colleagues or volunteer to work overtime, stay late, or come early. Things of that nature are kind of suspicious of diversion. They may have patients with insignificant uncontrolled pain. You will see an increase in the pain scoring when it comes to their patients that is inconsistent with other colleagues. You may also notice missing medications. There is help that's available for nurses who you suspect is abusing medication or alcohol abuse, any type of substance abuse really, or if you know someone who needs help but just doesn't know where to turn. The Florida Board of Nursing developed this program in 1984 called the Intervention Project for Nurses. Their number is 1-800-840-2720. Not only do they offer help, support systems, rehabilitation, things of that nature, but they also deem when the nurse is appropriate to return to business or have their license reinstated if the license were revoked as a result of substance abuse. Some of the criteria that they look for a nurse to return to practice or any practitioner to return to practice are the following. They do want to see a history of recovery stability. They want to assure that the person or the individual has an adequate support system in place. They make sure that there are problem-solving capabilities in that individual. They make sure the cognitive functioning is still appropriate for that individual. They make sure that the judgment is still intact and the coping ability in stressful situations is intact, so they don't return to the substance abuse. They also want to make sure that there is adequate decision-making capability. Now, some of the leadership styles that are useful for dealing with colleagues that are abusing substances, actually are a lot, to be honest with you. There aren't one in particular that is helpful with this. This is a very, very difficult subject to combat for most leaders. For example, authoritarian leadership dictates policies and procedures and decide what goals are to be achieved. It does offer low autonomy, but sometimes that's necessary when dealing with someone who needs help in this field. The next leadership style offers a maternal approach. They expect loyalty and trust from employees, and sometimes that can also be helpful when dealing with employees in this situation. The democratic approach takes all members into consideration, so it would also take the colleagues or the employees' ideas into consideration. Transactional leadership, it actually focuses on supervision and performance, and sometimes that is also necessary when dealing with an employee with some type of substance abuse history or pattern. We're going to discuss helpful leadership. We're going to discuss how to manage an employee with substance abuse problems. And it's important to stick to policies and procedures. Know your company's policy when dealing with someone with a substance abuse problem. You want to document everything from the professional performance to the appearance on employees when dealing with substance abuse problems. You also want to discuss what you see, what you notice with that employee. Give them the opportunity to explain themselves. Maybe there is just something else going on in their life and it may appear that they have a substance abuse problem. So have the discussion. You want to offer assistance if there is a true need or a true problem that exists with an employee. You also want to seek legal counsel. There are many laws involved when dealing with employees with substance abuse problems. So seek legal counsel if the opportunity should arise and you need to terminate that employee. You want to remain firm. They do have people with substance abuse tendencies can be manipulative in ways. So you do want to remain firm. Don't take it personal. Just realize this is not about you. They have a problem, but they need help. They are ill and they need help. It's nothing to do with you personally. Remain calm and avoid lecturing that individual with the substance abuse problem. And you also want to avoid derogatory terms such as a pothead or things of that nature. Remain professional at all times. And that is the conclusion of the Substance Abuse Project. Again, my name is Tamika Watson. Thank you for your attention.